So the NAIC is meeting for their summer meeting down in Louisville this weekend. Starts on Saturday. On the ACA front, we know network adequacy is top of the list. They're working on an updated model state law. Dave, you're going to be there. You've been tracking this. Why network adequacy? Why now?
Well, I think there's three contributing factors that really came together at once. I think the first is, issuers have begun narrowing their networks so they can compete on costs in the marketplaces. If they focus on lower cost providers, that brings premium down. And you have new entrants into the markets. You have all these new individuals purchasing coverage, and so now they're looking to access their physician. And so when you have a narrow network, their physician that they may be used to seeing is no longer in the network. And I think third, you have providers. Now the carriers are offering these new plans. They're on the marketplaces, and there probably wasn't good communication between carriers and providers as to which plans and providers were participating under. So I think when you put those three things together, it's kind of the perfect storm for the network adequacy discussion.
Issuer perspective, you used to work for a major carrier and helped them get ready for 2014. What's kind of driving this here?
Right, so I think from the issuer's perspective, they really have limited ability now to sort of compete on premium costs. So you have, in the individual small group market, you have community rating standards. You have the requirement to cover the essential health benefits. So benefit plan design, not as much flexibility. From a rating perspective, guarantee issue, community rating, not as much flexibility. So the quick and dirty way, when you're entering into sort of a new market, which hasn't quite stabilized yet, is to focus on unit cost.
So, Joanne, you do a lot of work with patient groups, consumer advocacy groups. What are you hearing? What has been the consumer experience with these networks?
Well, it's all been sort of at the front end. We don't know how it's all going as people use benefits right now. But as shoppers in the marketplace, it was impossible for many people to figure out whether or not the doctors that they see would be in the network for the plans they were considering enrolling in, which is just, that's just an easy thing to fix. Well, maybe not easy, but it's a place to start. That if I want to be a smart shopper and choose a plan that includes my doctor that I'm already seeing, that should not be an impossible task. But then too, even if I was a smart shopper and chose that plan, it could all change once I'm enrolled, because the plans retain the right to change the network at any point during the year.
Or a doctor could decide to.
That's true. The doctor could leave the network, the plan
anytime
can make a decision.
Year.
But the consumer cannot change, right? The consumer is locked into that plan for a year.
Dave, as you look at at what the issuer community is doing, a lot of them moved to narrow their networks in 2014. Are they under the pressure now to broaden their networks? What do you think is going to happen?
Yeah, so I think, for the reason we talked about, I think earlier, the environment is still a little bit unstable. The market hasn't settled, so I would think issuers will continue to focus on the narrow networks because it's a way to control price and compete on premium. So I don't think that will change.
So realistically, except in states that may have already acted, and there are a few of those, consumers aren't going to see a change in the standard, maybe not until 2017. But they could, and I think your point about the transparency and better information, I think while it's possible, I'm a little skeptical that a lot of the necessary technology and tools will be in place. And also important information like consumer satisfaction surveys. Right. Those won't be available until maybe 2017. So it's going to be a little while before we reach the promised land on any of this stuff.
Right, but that's part of the process. These things will get better this year than last, and so forth going, and I think consumers just need to sort of constantly be watching for the short-term gains and the longer-term goal of, what changes do we make over time, and making the case for those changes if needed.
Right. All right, well, thanks, everybody.
Good luck on the trip at the meeting.
Yeah.